Since the start of May, South Korea has reported 90 cases and 7 deaths due to MERS, the Middle Eastern Respiratory Syndrome virus. Scientists believe that MERS is transmitted to humans by animals, especially camels. But that's precisely the problem. There are very few camels in South Korea. Patient Zero was a Korean businessman who, on return from Saudi Arabia, sparked an Asian version of the outbreak that is leaving many with the question, will MERS turn into a global epidemic? Fortunately, the answer is no. And the start of this is because the South Korean version breakout of MERS is just as contained as other similar situations. A report published on June 9th by the American Center for Progress shows that similar outbreaks have happened in Middle Eastern countries like Saudi Arabia quite frequently. And the reason that the South Korean outbreak seems scarier is because the South Korean government has been much more diligent about reporting cases to the World Health Organization than its Middle Eastern counterparts. This makes it easy to blow the numbers out of proportion compared to numbers that weren't fully shared. But another reason to be optimistic is because it is very difficult for MERS to be transmitted from human to human. According to an article published in Nature on June 5th, the main way that MERS infects human patients is by reaching deep into the lung cavities. This means that simply coughing or even spitting on someone may not actually transmit MERS from one patient to another. Instead, a different type of environment is most at risk. According to the World Health Organization, in a June 3rd report, hospitals are the area where the transmission of MERS is most likely. Because of certain medical equipment, lung cavity containment from MERS actually can spread just because of simple operations performed on patients. The World Health Organization has already released a kit to help hospitals prepare and mitigate the spread of MERS within their boundaries. And since it's released much earlier than, say, the World Health Organization's handling of the Ebola virus crisis, they have a much better chance at preventing MERS from turning into a global epidemic.